Good afternoon. We are here today with an unscheduled press conference to share some concerning numbers surrounding our case rate from the last 48 hours. We know we have seen modest increases in our case count over the preceding week. We referenced that on Wednesday. I specifically said the slight or modest increase, but the last 48 hours we have seen that increase continue. We've been living for most of the last month on the precipice of tiers between the red tier and the purple tier. Several times our unadjusted case rate, which is what represents the true community spread, has been in the purple tier, but because of the state adjustment factor, it has brought us down. We now are concerned about the trends, and we're concerned about the likelihood that we could tip back into purple. If you go back over the last 6 days and you look at our unadjusted case rates by day, you will see it go from 6.9, 7.2, 7.3, 7.4. Yesterday was 7.7, and today we're looking at 7.8. And so again, our concern is that we could be headed into a higher or more restrictive tier. Because it takes 2 consecutive weeks, we're here today to really ask for extra vigilance, particularly over the course of the next few weeks. We're asking the public to do everything you can to reduce your exposure, reducing your exposure to possible spread or higher risk entities. Obviously, all the public health orders remain in effect, and today really is just a moment for us to be transparent about what we've seen in the last 48 hours and to really implore everyone to continue, especially as we head into the weekend, avoid indoor gatherings, utilize the face coverings. We're asking employers to please consider allowing people to telework to reduce the prevalence of individuals in those indoor settings and make sure that we're doing everything we can. What we're fighting for here is obviously to slow the spread, not just to save lives, but also to maintain our current status with what is open. And so Dr. Wooten is going to walk through a couple charts and again share with you the numbers, where we are, and some specific things everyone can do. But we wanted to come before you and just in an era of transparency share that the last 2 days in particular we've seen higher jumps than we had over the preceding days. And we really want to implore the public to please join with us in this effort. Let's try and slow the spread. Let's try and get our case counts declining. Again, we're now more than 6 consecutive days of creeping up and larger jumps in the last 48 hours. And so we're just asking, we want everyone to be aware of the situation we face and have us all come together as a community to do everything that we can, recognizing the overwhelming majority of San Diegans are doing everything right. But we just have to go that extra mile in order to protect our status and our tiers. With that, I'll turn it over to Dr. Wooten to give her update.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and welcome to the special briefing. Today, we are here to sound the alarm, first slide, that our actions matter, and we all must work together to keep San Diego County out of the purple tier or tier 1. In the next slide, I wanted to just show the county's Epicurve for COVID-19. These are the daily number of cases by illness onset. And the first major peak was when restrictions were employed by the state in the mid or the middle of July. And we saw that cases did decrease because people were practicing evidence-based strategies, wearing facial coverings, social distancing, staying at home, and not attending large crowds or gatherings. Those numbers did come down. And then in the middle of August, they started to creep back up, but at the end of August, August 31st specifically, the state rolled out the current tier framework. And as you can see, we are hovering just below 400 cases a day in some cases, but we need those numbers to consistently be much lower. The bar at the very right of this graph is the incubation period for COVID-19, so we anticipate that additional cases would occur there. Now, if we go to the next slide, just want to point out that testing positivity and case rates are the early indicators. And we are commonly asked about hospitalizations, our hospital capacity, but case rates and testing positivity, which leads to our cases, those are the early indicators of how widespread COVID-19 is throughout our communities. Hospitalizations, deaths, and outbreaks are further downstream indicators and serve as additional evidence that provides intel on the input of COVID-19 across the community. Now, with roughly, as we talk about outbreaks, with roughly 95% of the county's COVID-19 cases not related to an outbreak, still, these increased numbers of outbreaks occurring over the past few weeks is, again, a clear indication that COVID-19 is everywhere. Now, as previously shared in this slide, the Blueprint for a Safer Economy, this is the state's tier framework that depicts the levels of, or the level of disease transmission, which again, to recap, is widespread, moderate, minimal, or rather widespread, substantial, moderate, and minimal. And San Diego is substantial, which is the red tier or tier 2. Now, as of Tuesday, October 13th, while San Diego County remained in the red tier or tier 2, due to the adjusted case rate, the unadjusted case rate was in the purple tier or tier 1, and Supervisor Fletcher spoke about that. In this next slide, this shows the CDPH tier rating reporting date for each week that we report, and the corresponding week for which the metrics are reported. Next Tuesday, the state will report metrics for October 4th through October 10th, and then the following Tuesday, October 27th, the state will report data and metric results for October 11th through the 17th. October 17th is tomorrow. So basically, any actions, anything that we do now would not impact that week. But again, that's 2 weeks from now. So we are going forward. Our charge to the public is to implore you to take action to change the outcome for results that occur after next week. And really, for results that occur after October 18th and beyond. Just to note, it is too late, as I stated, to have an impact on data that will be reported for this week, this current week, in about 2 weeks. But going forward, the actions and charges that we are asking you to take will help improve and have an impact on whether we go to the purple tier or not going forward. So to drive this point even further, over this past week, we are seeing our case rates slowly creep up. In the next slide. So as you can see, the bottom, or rather the top, is the unadjusted case rates. And as you can see, we've slowly been going up since last week on October 11th, at least 1/10 of a point every day. And then on the 13th and the 14th was Wednesday. Since Wednesday, we have seen really a much higher increase from 7.4 to 7.7 on Thursday and 7.8 today. Now, if we take the adjustment for this, we still would be in the red tier, but this is just too close for comfort. So our actions, the actions that we were asking you to take today, we want to have those actions not have us in the purple tier for even unadjusted rates. So we want to drive that unadjusted rate back down. So in closing, and as a reminder, we can address the challenges of COVID-19 successfully, but again, we need your help. Continue to practice the non-pharmaceutical interventions that we talk about day in and day out, washing your hands, keeping 6 feet apart, wearing your facial covering when you go out into the public or go to various sectors or at work, as well as avoiding crowds, gatherings, and large events. And most importantly, we really ask you to stay home if you are sick. Because all of these actions, if you do these actions will help to decrease testing positivity rate and also decrease our case rates. And in the next and last slide, by decreasing our testing positivity rate and case rates, we can open up. There are still, again, we are seeing more people that are out on the freeways, so we're asking businesses to really focus on teleworking or telecommuting, commuting from home as much as possible so that we do not have people at work. And again, if people are sick, don't go to work. We've been seeing cases where that's been occurring. So we want to really ask you, do not go to work if you are sick, and instead go to a testing site and be tested so you can determine if that illness is related to COVID-19. So with that, I will turn it back over to Supervisor Fletcher. Thank you.
Thank you. Thank you, Dr. Wooten. And just to reiterate, we do control our own fate moving forward as a region. Our ability to slow the spread will lower our case count, which will control and influence the tier we're in. And again, we're asking the public, please avoid the gatherings, whether they be organized or informal gatherings in indoor settings. And in particular, we're asking businesses to please work allow your employees to telework. These are two steps we can take. We continue to have robust testing available. If you have any symptoms, please go to one of our testing sites and get tested. Turnaround time is very quick. If you feel sick, please do not go to work, get a test, and respond accordingly, and let's all come together and try and slow the spread. But we do control our future direction and our fate based on our actions each day. With that, we'll go to our call-in questions for today.
Laura Acevedo with 10 News. Please state your question.
Yes, my question is for whoever decides to answer, but I just want, if you guys could express like how concerned you are seeing this change from Wednesday to Friday, and also, do you know what's contributing to it? Is it one specific outbreak or a number of outbreaks?
Yeah, we're very concerned, which is why we're here today. It's gone from a very modest gradual increase to a higher jump. And again, when you're right on the precipice, when you're barely making it in each tier each week, even what seems like modest increases can be enough to tip you over. And so that jump, again, if you go back just six days ago, our unadjusted case rate was 6.9. Now it is 7.8. That is the concern that we fear moving into a higher tier. There's not one isolated incident we can point to say this. There is widespread community transmission. We are in that substantial tier and substantial risk. And so there's not one individual thing you can point to and attribute it to, which is, again, why we're here just asking all of San Diegans to do everything we can, particularly limiting those higher risk indoor settings, those gatherings, individuals getting together, along with all of the public health advice that we continue to give around utilizing face coverings and hand washing, and all of those other types of things are helpful. Go to our next question.
Thank you.
Yes, thank you.
Alexis Rivas with NBC7. Please state your question.
I just hope if someone could provide a reminder as to if we were to return to the purple tier, what that would mean again in terms of restriction.
Yeah, the purple tier, it's outlined on the state website, in particular each sector, but what it does is reimpose additional restrictions on a variety of indoor operations. It is somewhat similar, although not exact, as the original state monitoring list, which we were on some months ago. But again, it would have an impact on our small businesses. And you know, what I think is important is not having them open, close, open, close. And so what we're doing here is fighting to maintain the tier status where we are. In the ideal world, we'd be anticipating, or we descending into a lower tier. Right now, we're fighting to stay where we are. And so we don't want to see indoor operations of these businesses that have been through a lot face the prospects of another closure. I also want to reiterate that it does take 2 consecutive weeks in a higher tier before you actually move to that higher tier, which is why, again, we're here while we're still presently in red, and we certainly hope to remain in red on Tuesday. But we're here just raising awareness about the concern, about the increase that we're seeing, and the need to have that extra vigilance to make sure we don't go in that higher tier and negatively impact those businesses that are already struggling.
I'd also like to just add one more follow-up question, if that's okay.
Sure.
We're seeing schools looking at reopening and inviting students back throughout the county. How does that factor into what you guys have been driving home in this press conference, especially about, avoiding these like indoor settings?
Well, all of the increased activity is the increased opportunity for spread. Now, we can do it responsibly and we can do it safely. But again, that takes the extra vigilance on the part of everyone. When you open more activities, it is natural that you will see some increased transmission, which again is why we're here in terms of really trying to raise awareness. We've done a good job as a region. I think the overwhelming majority of folks are doing everything they can. But if we want to have the opportunity to keep our small businesses open, if we want to have the opportunity to keep our schools moving forward, if we want to continue to move forward as a region, that's where we just have to have an extra focus on each and every one of us doing everything we can to slow the spread. And so we're going to continue to do that and continue to advocate for that every day. Thank you. I believe we have one text question. Thank you.
This text question is from Lindsay Winkley with the Union Tribune. Could you please explain which dates are being used to calculate the case rate that results in 7.8?
Do you have that? Yeah, we'll have Dr. Wooten walk you through that.
So if, everyone, I'm sure you know the calculations, but there's a 7-day lag, and then that's the prior 7 days. So the slide, if you could bring that up, that was calculated from October 11th through the 16th. The unadjusted case rate, that is that 7-day lag, and then the week after that. So that's specifically October 2nd through the 8th as of now. Does that make sense, or is that understandable to you? So the calculations were done on these dates, but the actual time period for which the calculations occurred was the week that we will be reporting next week. And but these were specifically calculated by our staff October 2nd through the 8th. But come next Tuesday, we will have results for October 4th through the 10th. So this is just being calculated to give everyone an idea about what's going on so that we're not caught off guard when the actual report is made next week.
Thank you, Dr. Wooten. We have one more text question.
It's a couple of questions from Jack Mulmud from News 8. And he asks, can you give any update on the quarantine and isolation situation? And have there been more Point Loma Nazarene students who have tested positive? And then he asks, are there any recent outbreaks reported in the college area that are related to SDSU students?
Great. We'll have Dr. McDonald address that.
Sure. Thank you for that question. Actually, all of our local universities that have residents on campus, so Point Loma, Nazarene, SDSU, UCSD, Cal State, San Marcos, all actually have websites that they update regularly, and Point Loma has been updating their website with the number of cases that they have had. They reported 2 new cases since, I believe, the last time that they updated it. And they also show the number of individuals who are under quarantine, which I believe is 66 the last time I looked this morning. But we were at the university yesterday and did a substantial amount of testing for which we're waiting for some results. But I will say this, the university has excellent plans in place to be able to handle any increased numbers of students who need to be quarantined or isolated.
Thank you, Dr. McDonald. That concludes our briefing for today. I'll just close by saying in San Diego, we've been a leader throughout this. We've done incredibly well as a region. We're not the only county in California that's struggling with increases moving forward. But we do believe that we do have the ability to get these numbers under control and continue to advance forward. We wanted to share the updated numbers, share some specific things we think we can do, and continue our daily effort to slow the spread, save lives, and keep us moving forward as a region. Thank you, and have a good weekend.